Thank you for joining us for this WTVA 9 News Coronavirus Town Hall. I'm Craig Ford. And for the next 30 minutes, we're going to answer some of your questions, just basically answer some basic questions that you and others may have concerning the coronavirus. Obviously, the world has changed dramatically in the past few weeks, and some folks, now that we've had some of the recent developments with public areas being restricted, schools being closed, a lot of folks may be paying more attention to the coronavirus than when this first may have come on. So we want to introduce Dr. H.F. Mason, who is the Chief Medical Officer for Baptist Memorial Hospital, Union County. He's also the hospital's Chief of Surgery. Dr. Mason attended medical school at the University of Mississippi. He completed his residency at Vanderbilt University. Dr. Mason, thank you so much.
Thank you, Craig.
So I guess we'll start really basic here.
Sure.
What is coronavirus, and why can it be so lethal?
Coronavirus is, well, actually, there's a family of human coronaviruses that affect humans, obviously. There are 4 that basically cause the common cold. Well, most of the time when you get a common cold, it will be one of those 4 types of coronaviruses. Over the past few years, there has been the development of some more serious coronaviruses. When the SARS outbreak happened a few years ago, when we had the Middle Eastern respiratory syndrome coronavirus causing those problems in the Middle East. This coronavirus that we're seeing is called a novel coronavirus. Novel means new. It's a coronavirus that we haven't seen before, and most of the time how that happens, it usually is with a coronavirus that has normally infects animals, and it mutates so that it can jump and transfer and infect humans, and that's what's happened with coronavirus, the novel coronavirus. The sickness that it's called is called COVID-19, coronavirus disease 19 for 2019, because that's when we first picked it, when it was first picked up over in China. Fortunately, the good thing is that the vast majority of people, 80% who get infected with the coronavirus, they're going to have mild symptoms. Maybe like a cold, maybe like a bad cold, flu-like symptoms, fever, body aches. For 15% of the people, it's going to be more serious, people who are at higher risk, older people. People who have chronic medical conditions, chronic heart disease, chronic lung disease, it can be a lot more problematic for them. For about 5%, it can be very, very serious, and it can even be lethal. The most dangerous thing about this virus is that just currently we don't know a whole lot about it. Fortunately, we're learning a lot more about it every day, which is good. But until we know more, it is dangerous.
So, again, we're starting basic here.
Sure.
Let's start with the symptoms.
Sure.
What are they?
The symptoms can range from very, very mild to severe. They can be just like symptoms with the flu or a cold. Fever, body aches. It can progress to difficulty breathing and shortness of breath. And the spectrum is very wide. Children and adolescents, they may have minimal, if any, symptoms. And older people can have severe life-threatening where they can't breathe at all and they need to go to the emergency department.
Gotcha. If you think you have it, these symptoms show up, what should you do?
Well, first of all, if you think you have it, don't panic. Stay calm. That's the first message that we'd like to tell everybody. The first thing you should do if you think you have it is call your doctor and tell them, hey, I'm concerned that I might have the coronavirus. They're going to ask you some questions, and based on the CDC guidelines, some of the questions they're going to ask, okay, are you having flu-like symptoms, fever, body aches, cough? And I forgot to mention cough with the other symptoms. And it's really not a productive cough. It's more a dry, hacking cough. Are you experiencing any of these symptoms? Have you traveled to any of the Category 3 countries listed on the CDC's website? And I highly recommend that people look at the CDC's website because there's a wealth of information there. Those current countries right now are listed as China, Korea, Iran, and mostly all of Europe and the UK. Have you traveled to those countries? Have you been around anybody who has had the coronavirus? If you answer no to any of those questions, they may just tell you to stay home, monitor your symptoms, and let us know if you get worse. If you answer yes to those questions, they may ask you to come in and get screened.
Okay. All right. We will get more questions for you momentarily, but right now we're going to take a break at our WTVA 9 News Coronavirus Town